Hello, welcome. Today I have the great pleasure of speaking with a gentleman named Toby White. He unfortunately developed cancer at a young age, and he details the journey of receiving the news, his treatment, and ultimately his ongoing recovery. I hope you enjoy this and get something useful from it. So, Toby, thanks so much for doing this. If you could
No
start us at
problem.
the beginning, just remind us how old you were when you first began getting symptoms.
Yeah, so I would have been 29, and the first real signs of any problems would have been the summer of 2019. Me and my wife, or then girlfriend, went on a holiday in Paris for the weekend, and we're walking around a lot. Going on the metro and doing a lot of walking. And that was getting really quite painful. What we ended up doing when we got back, I went to the doctor's sort of after hours doctor's appointment, and the GP I saw, he just had a look at the legs. I had a prod around, saw that that's not quite normal. X-ray came back, nothing really to show on the X-ray. And they wanted me to then go for an MRI and a sort of CT. Came back and said that we think this is cancer. We think this is osteosarcoma, so a form of primary bone cancer. They were quite concerned that my leg would, or potentially, or at risk of breaking, because this type of bone cancer can weaken the bone. And they were concerned that I'd not parked in the hospital car park. I'd parked probably about half a mile or more away from the hospital, because it's the hospital car park's always busy, and normally have to pay more. So I'd walked up quite a big hill in Northampton to the hospital, and they were worried that my leg would break. Walked out of there and didn't use the crutches. Walked back to the car. I was like, I don't know what to do with these, and got home and called my parents and gave them the update. And yeah, that was obviously all a little bit shocking. Normally this form of cancer only, or tends to affect younger children, and I guess early sort of teens, sort of mid-teens. Doesn't really affect beyond sort of in your 20s. It's pretty rare for anyone beyond their teenage years to get it, because it normally affects growing bones.
The next stage was surgery then.
Yeah, so this was just thinking of the timeline. So yeah, the appointment at Stanmore for the official diagnosis, if you will, was 19th of January. And then they sort of said they gave me the plan. They said, you've got a couple of options. We can either do full knee replacement and an internal prosthesis, but the other solution that gave me as well is they could have done I guess, below knee amputation, or possibly above knee amputation. Was the other option, but they said that would have been a lot more traumatic, and I was on a standby list essentially from the 19th of January 2020 for an operation. I was quite relieved, because I knew, okay, now we know what's happening. I think my mum was very upset, and my dad as well, my sister.
Yeah.
I'd been upset up until that point, but I was quite relieved that I actually had a way forward. They called me and said, get down to the hospital. We've got a slot open. We'll get you in. I had the replacement knee, plus the rest of the internal prosthesis going on. So I had this cricket bat splint that they put me in, and I wasn't able to move my left leg then for 6 weeks.
So chemo went on for how long?
It would have been about 8 months. Some delays in that process as well. I think the PICC line, so where the chemo was going in, got infected in my arm.
Right.
Funny enough, the infection there caused a higher temperature than I had with COVID. So I hit a temperature, I think, of think 40.5 degrees at one point.
Wow. I suppose the worry there would have been sepsis or something like that. The
Yeah.
concern.
Well, this is it. It goes the other way. I mean, it's not an uncommon thing that the lines get infected.
How did the side effects? What side effects were there for you?
So touch wood, sickness wasn't so much of a problem. I never got physically sick with it.
Mhm.
It was more, I guess, lack of appetite. I wasn't really. I didn't know it at the time, but I wasn't eating as much as I had been. The last week before I was due to go home, someone had come in and had COVID. So because I was on week 2 of that cycle, that first sort of introduction to the chemotherapy, my white blood cell count was right down. All my sort of immune system was basically through the floor.
Mm.
I had no immune system essentially at that point. No one really knew what COVID was or how contagious it was, so they had
Yeah.
brought someone in with COVID, and I immediately contracted COVID. The strategy was to pump me full of antibiotics, basically. So IV paracetamol to keep the temperature down, and then just
Mm.
antibiotics to try and counter or just try and boost my immune system.
Yeah.
They didn't have anything else to treat COVID at the time. They hadn't had enough time to sort of figure anything out. They'd stuck me in this room underneath an air conditioning duct, so I was freezing on top of having a temperature. So yeah, I mean hot, cold, but
Horrible.
more cold. So that was not good.
And you had no visitors during this time.
No, throughout the whole. So that
Wow.
was about a month of just isolation. I mean,
Blimey.
throughout the whole year when I was going in for the treatment, I couldn't have any visitors either because the whole ward was essentially locked down. We couldn't, as patients, couldn't leave it, and any visitors couldn't enter because the risk was too high to everyone on that ward.
How was your mood during that time?
Generally speaking, not not too terrible. So I guess, quite upbeat. I mean, I got used to it as the sort of weeks and months sort of dragged on. I mean, the whole COVID thing was something I could have done without right at the beginning there.
Yeah.
That was like, I've just started this whole process and then this has hit me. And, that was sort of, very worrying because no one really knew anything about COVID or,
Mm.
how to deal with that. Plus someone going through chemotherapy. So it was double whammy. But after that, I'd sort of, yeah, after I've returned back to normal and sort of gone back in and the sort of chemotherapy could continue. I sort of got into sort of process because I was seeing the same sort of nurses and the same oncology consultant at Leicester, so I was seeing familiar faces and like healthcare assistants and the doctors coming around the wards and some of the other patients that I was sort of seeing again. So you become institutionalized, I think, a little bit because you're just there
Right.
so frequently. The hair loss, I think, it impacts women more, sure, going through
Right. Yeah.
chemotherapy.
Yeah. Yeah.
Um, I wasn't. I was worried about the beard. I was like, that was. I was more concerned about the beard, losing the beard. To be fair,
I've been sitting here
but
with beard envy like nothing else.
the
Tell
hair,
me,
everything.
oh,
Poor
did you lose your
thing.
beard?
Yeah, the beard, beard and hair. That was, I think, in the first month. Some hair started coming out, and I
Right.
got
Right.
a couple of the healthcare assistants. I said, right, now's the time. They came just. I wasn't. Some people wait. I could have waited until it all fell out or just came out in clumps or whatever. I was like, just
Yeah.
get it done. So yeah, the shaved came along, shaved it all off.
That I can relate to.
I couldn't
Yeah.
really start the physio because I was dealing with the chemo, going through the chemotherapy. I had no real strength. I'd lost, I think, nearly a stone in weight from uh, the day of the operation to when I started the chemotherapy. So
Right.
I'd lost a lot of muscle mass as well from not
Yeah.
moving the leg. So a lot of that was muscle mass and just not moving, basically. Because of COVID, by the time I could start any physio, no one was seeing anyone in person. So they were starting to do things over the phone and video. So every day I had to do certain exercises for the leg, even though it was in a straight brace at the point. There were things that they wanted me to do to try and build some upper leg strength again. So I finished like chemo towards the end of 2020, and by I think New Year 21, I was sort of doing my first sort of walks outside and sort of getting out and about, which was nice. Not
Yeah.
sort of walking, in a hospital ward or somewhere. And I think it wasn't long after that they had me move to sort of full flexion on the brace, and then not long after that they wanted me to get rid of the brace altogether, which was really bizarre. But as soon as that came off, I was able to. The physio was really ramping up, and that was mostly with walking. It was
Yeah.
just walking, getting back, lots of walking. I'd never really dealt with sort of the whole process of going through the sort of treatment in hospital, not seeing anyone, that being completely isolated for almost a year. And I mean the ward I was on as well wasn't necessarily the I'll say the nicest. I mean it's all the staff were nice, but the people that were also being treated there were going through some rough times, and some of the people that
Yeah, of course.
were brought in on that ward, I don't believe made it through one thing or another, or COVID certainly wasn't helping things.
Yeah, of course.
But there were some people on there that I don't believe made it, and it was sad because they couldn't be moved out of the ward. They were brought into the ward, but they couldn't be moved out, so they were moved to a side room. And that was really rough. So I certainly had a lot of, I think, like survivor guilt as well, after the whole sort of experience, and that really shook me up. So yeah, the counselling certainly helped. I mean, it's just a case of talking about it all, and a bit like we're doing now, sort of talking about it, because I hadn't really talked about it. I was sort of completely shut down. I think as far as I was concerned, my family concerned, like the chemotherapy had stopped. I'd had the operation. I was out of the hospital. Good, tick. And then getting on the physio, being able to get up and walking again, tick.
Yeah.
We're sort of ticking off all these sort of milestones, but not really dealing with the sort of mental aftermath, And I
Yeah.
think all my sort of feelings were just, and
And it sounds like that after going through all of that stuff,
it was a lot.
when you had
Yeah.
some, when you had some space, when actually you were sort of getting out the other end of that particular period, you had a bit of space for your body to allow and start thinking about, actually, let's process some of this stuff
Well,
now.
this is it. I think that was it as well. At the time, everything was just so focused. It was hospital 3 weeks, treatment, back home
Yeah.
for 2 weeks, try and do some work for work, and then go back into the hospital again. The whole cycle would continue, and it was like that throughout 2020. So there wasn't really any time to think about anything else.
Financially, there were some measures that you had taken that actually helped you out quite a lot. Is that correct?
Yeah, there were. So there were a lot of grants. I had health insurance, thankfully, which
Right.
helped with the loss of income as well. I had loss of income cover, and the Macmillan team at the hospital were great in helping with sort of uh, stacks of paperwork, basically. Dealing with the insurer and figuring all that out, and providing all the medical documentation and notes, but that certainly helps.
And you also took some insurances around fertility because it's well documented that chemo can
Yeah,
render people
this is it. I mean, there's no there's no guarantee that you won't become infertile, essentially, as a result of it. They before the chemo started, that they went through that process. So they got me to
Yeah.
fertility clinic at Leicester, and made sure that I had sperm frozen. We're actually going through IVF process at the minute, so
Right.
that's a sort of journey, another journey we're sort of
The
going on,
challenge too, isn't it?
which is
Emotional
a
roller coaster type
emotional
challenge.
roller coaster, exactly. But that wouldn't have been possible had we not, had my
Yeah,
sperm
right.
not been frozen beforehand.
Like that movie moment that almost never happens because things happen so gradually usually in life.
Yeah.
But did you ever get that moment of I'm all clear kind of thing? Did you ever get that sense of
Well, this is the weird thing with this form of cancer. So the you don't get the bell ringing thing. You're essentially in observation for 10 years.
right, right?
So I won't be officially clear until, where are we? 2030. Yeah, yeah, 2030. So that would have been a decade.
Finally, if I could ask you, is there any what's been the effect on your life in terms of how you might approach life going forwards?
Oh, definitely done. I've done. Yeah, I said a lot of people. I've done more since being diagnosed than I did before. You were saying as well. You tend to just go through life on. Um, I was coasting. Just going through sort of 20s. Not really. Um, I've never really been one for like having many aspirations or wanting to travel, or I was quite happy just sort of working on cars and going
Hmm.
out doing city trips and things like that, and holidays, but not really having any. We had things we wanted to do, but not really having any sort of targets or time frames to do any of that. And
Hmm.
since um since 2020 and going through all this, it's been, we've done just bam bam bam. It's just getting those things done and not sort of really hesitating for it, and just you don't know what might come. It came out of the blue. That diagnosis. As I said, there's
Yeah.
no family history, no one else with this kind of cancer in our family that we've known about. So yeah, just get on with things and get things done.
Hmm.
Tick things off your to-do list. um, get out there, and yeah, don't wait. Is what I'd say. Yeah.
So on that note, I'm just going to thank you so much for giving us your
Oh,
time.
you're welcome. Yeah, I know
An
we're rambling on a
amazing
little bit.
story, and I wish we're all hoping that it carries on going as it's been, and you look back on this as a memory, and we're
Yeah.
all praying for you with the IVF. I hope that works
Oh,
out for
thank
you
you.
guys.
Yeah, thank you very much. Yeah, brilliant. Oh, thanks
Thanks,
for
man.
hosting. Yeah.
Thanks so much.